learned something this morning. I learned that if something is wrong with your teeth, you can go blind. You can even lose your life. If you are watching this and something is wrong with your teeth and you think it's nothing, I think you're watching the right content, because with me, I have some professionals to discuss some timely topic about the importance of seeing a dentist. How important is dentist appointments?
Okay, that's actually a very broad question. How important are the dentists, right? So you might want to first of all understand what role the dentists play to taking care of your teeth, and what role the teeth play to your entire body as a whole. So the first importance of the dentist is to prevent you from getting to a point where you want to, where you have an issue. Would want to prevent you from having toothaches, swellings that can come from toothaches, because when you're talking about toothaches, there are actually sequels that come with it. You would have a sensitivity that could probably start as a whole, then you have sensitivity that comes in, then you have pain that could be bearable, comes and goes, then you have the pain that just stays, and then of course you can even get up to death. So the importance of the dentist, first of all, is to prevent you from getting to that point where you have toothaches. But then there's also the importance of also solving the problems when you have a toothache.
Thank you very much. Thank you. See, Dr. Inda, you made a tweet. You lost someone you were caring for as a result of a problem with their teeth. And when I saw your tweet, I was like, can someone lose their life as a result of teeth problem? Is it possible?
Yes, it is. It's very, very possible. Usually it starts from the tooth structure. There are 3 layers of the tooth structure: the enamel, middle layer, the dentin, and then the pulp.
Okay.
So when you have a cavity in the enamel, usually you don't have pain, no sensitivity. It's fine, right? And then it goes on to the dentin, you have sensitivity. The moment you get into your pulp, that's when it results to actual pain. Now, if you don't do anything about that, we have something we call apical periodontitis or periapical abscess. Like, it's a progression. So there you have pus accumulation, pus discharge, so to speak, pus accumulation, right?
From the mouth.
Then, yes, but it's inside your bone. It's in that space. It doesn't do much. It becomes tender. The tooth becomes tender. If you still don't do anything about it, the pus obviously gets bigger. Now, in getting bigger, it grows, right? And then in the muscles of your face, there are spaces in between them. So we have the abscess growing and then getting bigger. That's when you have the swelling that is visible by people. If you leave the swelling, it moves into the other space. The other space, we call it Ludwig's angina. It could grow so much that it blocks your airways from breathing. It could also grow so much that, sepsis, infection goes around your body. You get into septic shock, which was actually what happened with the patient. He presented really late and all that. And then you have a cardiac arrest.
When I think about a dentist, or when I see a dentist, all I think about is the teeth. Are you saying there are dentists who care for other parts of the body?
No. The teeth is the entrance to the body. So if you don't take care of it, anything that happens will be able to enter into the body, putting it in the layest man term. So what we do is prevent anything from going there into your body.
This is interesting, but before I ask another question, let me ask two points. That someone made a tweet. He said, if you've never seen a dentist, if you're 30 plus and you've never seen a dentist, you are living a dangerous life. How true is that?
100% true.
The reason why I said how true is that is this. I don't think my father had ever seen a dentist in his life. What it concern them? Like, they are okay.
The first thing to know is that in the mouth, there's what we call plaque and calculus.
What?
There are plaque and calculus, dental plaque and calculus. They accumulate on the teeth due to a lot of debris that comes.
So what is? Mention it again and tell us what it is.
Okay, dental plaque and calculus. Dental plaque is like a slimy or sticky film of bacteria and other things, dirt, everything that sticks to the teeth. And after some time, it becomes solidified.
Wait, sorry, a minute. Now, these sticky things,
Yes.
how? I don't understand. Do they come as a result of you consuming junks, maybe chocolate or whatsoever, or they are in the hair or
So
something?
let me put it this way. Plaque occurs naturally in the mouth. Like once you finish brushing your teeth, the way you will notice that you have plaque in your mouth. For instance, when you wake up in the morning, if you run your tongue around all your teeth, you will notice something that appears. You're not feeling your teeth directly. There is something that is very slimy, that is sticky.
Feels rough.
It feels very rough. You understand? That layer is what we call plaque.
Okay.
If you don't clean your mouth properly, or when you do, you leave it for a long time before you do. There are people that don't brush every day.
They don't brush their teeth every day.
Yes. There are people that brush once daily, which is not advisable. You're supposed to brush like twice daily. There are also techniques for brushing that you should know. It's not just about scrubbing the mouth and thinking you've done it. And also, people should brush for about minimum 2 minutes and about 3 minutes.
The Gaussian.
Yes. So people that are rushing, the Russians, as you said, they just 30 seconds, they are done. That leaves enough time for the plaque to accumulate. And when it does, it attracts bacteria. There are bacteria not only in the mouth, like they are just there, the same way there are bacteria in other parts of the body, on the skin and all that. They won't cause harm to you if you don't feed them or make them cause harm to you. Part of the things that will make them cause harm to you is leaving your mouth dirty for a long time. After eating, there are food particles in your mouth that you don't clean off. Then you take a lot of sugary things, you don't clean your mouth after you chew gum and all that. This leaves a lot of food for the bacteria to feed on. And as they feed on the food, they also release acids that lead to cavities. That's actually the source of cavities, because the acid will keep causing decay on the teeth. It will first cause erosion of the enamel. That's the outermost part of the tooth. Then after that, the bacterial infection will continue to spread. When you leave your teeth unattended to, or you've never seen a dentist, the plaque will accumulate dirt and accumulate other materials to become solidified. Now that won't be like stone. That's what we call calculus. And toothbrush cannot remove that. How to actually remove calculus? The only way you can remove calculus is for a dentist to use proper professional equipment to remove all the dirt. And they are supposed to do this at least twice a year. So if by the age of 30, one has not started doing it, it means that you have 30 years worth of
So when you say you're supposed to do this twice a year, is that what it's called, scaling and polishing?
Yes, that's exactly what's called
okay.
scaling.
Cleaning and polishing. Sorry, let me cut into your line of thoughts, right? So one time I was discussing with a friend of mine, and he said, forget all this dentist, Gary, that if you go for cleaning and polishing, or whatever you call it, cleaning and polishing, right? That if you go for cleaning and polishing, the first time that is the beginning of your problem. Before your dentist appointment.
Yes.
What was your view about seeing a dentist? Then after, what is your view now?
First time I went to the dentist, I think it was my mom that needed to get her braces done. And then she just said, okay, do scaling and polishing for my child. And then I felt the difference in my mouth.
Definitely.
And I was like, there's
What
no
was the
going back.
difference? Ow.
You can just feel
Just
how things have been removed from your mouth. Like the space in between
Feel
your
lighter.
Yes.
It's like there's more space there. Your mouth just feels.
Lighter.
I
Yeah,
felt great.
exactly.
After. I mean, it was uncomfortable for my first time because I'm like, what are you guys doing? It's like, open your mouth. And yeah, but after he was done, I was very pleased. So I just made it a thing. You know what, scaling and polishing. But then also, like you said about knowing how to brush. I think it would be nice if you actually speak more to it, because I also learned a thing or two about that.
Okay. For adults, the proper way to brush, you open your mouth, sweep your mouth. It's like your mouth is dirty, you want to sweep it. There are people that do this up and down, up and down.
Scrubbing.
It's just the gums.
What of like this?
It's just the gums. When you want to brush, you're supposed to angulate your brush at about 45 degrees to the teeth. It's just like you're making it face the gum and the teeth a little. That junction between the gums and the teeth, because in between the gums and the teeth there is a little space where dirt can go into. You angulate your toothbrush, you sweep it out. From up, you sweep it down. From down, you sweep it up. So you're supposed to clean every part of the teeth. So it's not just about.
Let me ask a question, and I want to direct that question to you, Dr. Inda. How important is my type of toothpaste?
Honestly, all you need to check for when you want to buy a toothpaste, 250, 1,250, whatever the price. Check
Okay.
back, look for any toothpaste that has fluoride in it, because that component in particular is what helps in
Fluoride.
yes.
To add to what she said, sometimes you might see some color codes on the toothpaste.
Yes.
You can see black, you can see blue, you can see green. Black is more like it's outrightly chemical. Green shows that it's more of natural product, a mixture of chemical and natural. So that also depends on your choice. And the fluoride can come in different forms. It can come in stannous fluoride, it can come in sodium fluoride, or whichever formulation it will come in. But the actual thing is fluoride.
What about people that use chewing stick?
It's not an entirely bad thing. What we tell our patients, we have patients that will come, or it's chewing stick. They were like, that's fine. Just put fluoride in. Just put toothpaste on the chewing stick.
What about people that use salt?
So I feel like it was more about awareness and having the right knowledge. But now there's the right knowledge. You can even have salt available in toothpaste. Do you understand? It comes in various forms. So, salt is not just the regular table sodium chloride you have. They also for other kinds of salt. You understand? And they probably do the same thing. So why not go for one that gives you a full package rather than one that just gives you one aspect of it?
Thank you so much. I mean, I've learned a lot from this conversation, and I believe so many people watching have learned a lot too. I think I'll close with this. Let me ask you this, doctor. When you see people with bad mouth odor, is it as a result of a problem with the mouth or the teeth, or is something else?
When you have bad breath, a lot of things that can cause bad breath. Yeah, if we want to talk about it, the actual way, there's the local effect. Local effect has to do with what occurs in the mouth. Then you have the systemic effects coming from the mouth. So what are the possible local effects that can cause bad breath? You can have a decayed tooth. You can have a hole. When you have a hole, food can pack in there and stay there for months. Calculus, like initially said, calculus is like a agglomeration of food debris. All the food debris you've eaten, bacterial, and then calcium that solidifies it. So you have pockets, periodontal pockets, like in between your teeth. You have holes in between your teeth, not on the teeth itself, or just in between. Those can also accommodate food debris. And you want to talk about systemic causes. People that have something you call GERD, gastroesophageal reflux disease, is a gastric issue, a stomach issue, right? They have regurgitation of what they have eaten back. So that regurgitation can cause bad breath from the stomach. Even some level of peptic ulcer disease can give you such that. Then there's also a level of liver disease that can give you bad breath. It's called fetal hepatitis. It's actually a kind of liver disease, a symptom of liver disease that can give bad breath. We don't really advise so much of ginger, garlic, and even alcohol. But once you have bad breath, you start buying mouthwash. It does not always the first to know what is causing it. Is it a decaying tooth? Is it dirty in your mouth? You can even have something called xerostomia, dry mouth.
We had a patient recently that came to complain of bad breath, but then they specified it happens in the morning. So there's something we call morning breath. That's normal. Usually when you sleep, saliva production is reduced, so your bacteria has time to play. Let me put it that way. So all you just need to do is you brush and you're fine.
Thank you very much. So let me ask you, doctor, how expensive are dentists?
It depends. What you spend in the whole year doing these things is much less than what you spend if you come up with just to prevent that just one dental problem. If you take your time, do everything you need to do, listen to the right advice, what you will spend on 2 sessions of sealing and polishing in a year, for instance, is less than what you will spend if you come down with something like Ludwig's and that's if you
don't know what you will spend.
So
You don't want to
people's
know.
focus should be more on prevention rather than saying, okay, it's very expensive. Have you gone there before? And then there are people that have whose companies or places of work have HMOs.
Yeah.
They don't even make use of it.
Wait, are you saying most of the HMOs covers the care for my teeth?
A good number.
Yes.
A good number of them cover.
Are you serious?
Yeah, I know NHIS does.
Wait, are
Yes.
you serious?
Yeah, NHIS,
So if I
massage.
have a job,
Salustros.
there's 80% chance that my company had already paid for me to see a
You
dentist.
just need
You just need to find out
what
Yeah.
you pay
to what
is
extent
very little.
you're covered.
Yeah.
Yes.
Yeah.
For NHIS, it covers majority of the preventive procedures. So why not just make use of them? But it would be better for people to find out what HMO they are under and whether they cover any of this.
Thank you very much. I mean, I've really learned a lot from this conversation. I believe so many people that are watching right now have learned a lot. And if this content is very useful to you, please share with your friends. Let them benefit from this conversation. And please, I encourage you to subscribe to our YouTube channel and please watch the next video. Thank you.